Your baby has one kidney. And right now, you're probably doing the exact thing that will make your fear worse. You're searching, you're scrolling, you're finding worst case scenarios written by strangers who've never held your child. Stop. Close those tabs. For the next few minutes, let me give you what you actually need: the truth, the plan, and proof that your child's future is far brighter than your fear is letting you see. Imagine holding your hours-old baby for the first time. You're exhausted, overwhelmed, and completely in love. Then a doctor walks in and says those words that change everything. "We found something. Your baby has only one kidney." Your world stops. Your mind races. Will my child live a normal life? Can you survive with one kidney? Did I do something wrong during pregnancy? If you're feeling any of this right now, I need you to hear something before we go any further. You are not broken for feeling this fear, and you are not alone, not even close. Let me share a case scenario based on real medical experiences that illustrates what many families go through. We'll call this Mom Maria. Maria delivered a healthy baby girl named Sophia at 39 weeks. Perfect weight, perfect color, perfect cry. But during a routine prenatal ultrasound months earlier, the technician had noted something unusual. Only one kidney was visible. The other one simply wasn't there. Maria spent the rest of her pregnancy in fear. She searched forums where parents shared worst-case scenarios. She read articles that made her feel like her daughter would be fragile forever. By the time Sophia was born, Maria was convinced her child would need constant medical care, special diets, and a lifetime of restrictions. Here's what actually happened. Sophia is now 7 years old. She plays soccer, she swims, she eats regular food. Her single kidney has grown larger than a typical kidney, which is exactly what healthy solitary kidneys do. Think of it like a muscle that grows stronger when it's the only one doing the work. This compensatory hypertrophy allows one kidney to filter blood as effectively as two. Maria's biggest regret, she says, is spending Sophia's first year in fear instead of joy. But Maria's experience reveals something important: the information gap. She was given a diagnosis without a roadmap. Today, we're going to build that roadmap together. Now let me tell you about another family. We'll call them the Johnsons. Their son Ethan was also born with one kidney, but their experience was different from Sophia's. And understanding why is critical for every parent watching this. Ethan's case was what doctors call syndromic unilateral renal agenesis. It wasn't just his kidney. He also had subtle differences in his ear formation and a slight curvature of his spine. None of these were obvious at birth. They were discovered because his medical team knew what to look for. This is why the distinction between isolated and syndromic matters so deeply. Isolated unilateral renal agenesis means the condition occurred on its own, with no other structural abnormalities. This is the more common presentation, and the long-term outlook is generally excellent. Syndromic unilateral renal agenesis means it's part of a broader genetic or developmental condition that may affect other organs. This is less common but requires more comprehensive evaluation. Your child's medical team should perform a thorough physical examination and may recommend additional imaging or genetic testing to rule out associated conditions. Maria's daughter had the isolated type. Ethan had the syndromic type. Both children are doing well today, but their follow-up plans look different. This is not a one-size-fits-all diagnosis. Let me explain what actually happened inside the womb. Understanding this is the first step to releasing the guilt so many parents carry. During fetal development, the kidneys form very early. By about the 5th week of pregnancy, the structures that will become the kidneys begin to develop. In unilateral renal agenesis, one of two things happens. Either the ureteric bud, which is the tiny tube that triggers kidney formation, fails to develop on one side, or the metanephric blastema, the tissue that would become the kidney, doesn't form properly. The result is the same. One kidney never develops. Here's the crucial point. The remaining kidney is not defective. In the vast majority of cases, it's completely normal. And because the body has an incredible ability to adapt, that single kidney typically grows larger and filters more blood than a single kidney would in a person who has two. But not everyone's solitary kidney functions identically. This is where medical follow-up becomes essential, not optional. Multiple long-term studies following children with solitary kidneys have found consistently reassuring outcomes. The majority of children maintain normal kidney function throughout childhood and into adulthood. However, research has identified 3 risk factors that require closer monitoring: protein in the urine, high blood pressure, and recurrent urinary tract infections. These 3 things matter far more than the fact that there's only one kidney. Before I give you your action plan, I want to pause here for a moment. Because if you're a parent hearing all this for the first time, you might still be stuck on one thought. Did I cause this? No, you did not. Unilateral renal agenesis is not caused by anything a mother did or didn't do during pregnancy. It's not from that one glass of wine you had before you knew you were pregnant. It's not from the cold medication you took. It's not from stress at work or the flight you took during your second trimester. It's a developmental event that occurs very early in embryonic life, often before a woman even knows she's pregnant. Release that guilt. It doesn't belong to you, and holding on to it won't help your child. Being informed will. Let me give you the action plan. 5 evidence-based steps you can take starting right now. Step 1. Confirm the diagnosis with appropriate imaging. A postnatal ultrasound should be performed within the first few weeks of life. This confirms that one kidney is truly absent and that the solitary kidney looks structurally normal. In some cases, your child's medical team may recommend additional tests. A DMSA scan can precisely measure kidney function. Avoiding cystothrogram checks for urine reflux that could damage the kidney over time. These are not routine for every child, but they're important to discuss with your specialist. Step 2. Understand the sports conversation. This is one of the biggest sources of parental anxiety. Many parents immediately think their child can never play contact sports. Current American Academy of Pediatrics guidelines do not recommend routine restriction from contact sports for children with a solitary kidney. The decision should be individualized based on your child's specific anatomy, kidney function, and the type of sport. Discuss this with your pediatric urologist before you bench your child from activities they love. Step 3. Maintain healthy blood pressure. The kidney plays a central role in regulating blood pressure. Children with a solitary kidney should have their blood pressure checked at every well-child visit. Elevated blood pressure in a child with one kidney is never something to ignore. It requires prompt evaluation because uncontrolled hypertension can damage the single kidney over time. Step 4. Prevent and aggressively treat urinary tract infections. A UTI in a child with one kidney is different from a UTI in a child with 2. There's no backup kidney. Any infection that reaches the kidney needs prompt and complete treatment. Teach your child proper hygiene as they grow. Encourage regular hydration, and never ignore symptoms like burning with urination, fever without a clear source, or new onset bedwetting in a previously dry child. Step 5. Build your medical team and stick with them. Your child should have a pediatric nephrologist or pediatric urologist who follows them consistently over time. This isn't a one-visit diagnosis. It's a long-term relationship with a team that knows your child's baseline and can detect subtle changes before they become problems. Now let me give you something you can use immediately. If you're holding a newborn with this diagnosis right now, here's your 48-hour plan. Hour 1. Breathe. Your baby is here. They're breathing. They're real. This diagnosis does not define them. Hour 24. Write down your questions, all of them. The ones that seem silly, the ones that keep you up at 3 in the morning. Take this list to your next appointment. A good doctor will answer every single one without making you feel rushed. Hour 48. Find your community. There are parent support groups specifically for families of children with congenital kidney conditions. These groups exist. The parents in them have walked your exact path. They know things doctors sometimes forget to mention, like how to handle well-meaning relatives who treat your child like glass. Now, I want to address something many parents think but are afraid to ask out loud. What about the future? Will my child need a transplant? Will their life be shortened? Here's the honest, evidence-based answer. The overwhelming majority of people born with one kidney live completely normal lives with normal lifespans. Many don't even know they have a single kidney until it's discovered incidentally on imaging done for an unrelated reason decades later. I've seen patients in their 60s and 70s who discovered their solitary kidney by accident. They lived full lives without ever knowing, but this doesn't mean zero follow-up. It means the follow-up is about prevention, not crisis management. Annual checkups, blood pressure monitoring, urine testing. These simple steps catch problems early when they're most treatable. Remember Sophia? She's 7 now. She knows she has one kidney because her mom explained it simply and without fear. She tells her friends, "My kidney works extra hard." And then she goes back to playing soccer. And Ethan, the boy with the syndromic form? He's 10 now. He sees his specialists regularly. He takes medication to protect his kidney function. He plays baseball. He's doing great. His parents will tell you that the diagnosis was terrifying, but the reality has been manageable. Your child's story is still being written, and it's going to be so much bigger than this diagnosis. If this video gave you even a moment of relief, hit like. It helps other terrified parents find this information tonight when they need it most. And if you're the parent of a child with a solitary kidney, tell me your story in the comments. What do you wish someone had told you on day 1? Your experience could be the light another parent desperately needs right now. I read the comments, and I use your questions to create future videos that directly address what keeps you up at night. Next, watch the video on your screen. It explains the exact difference between mild and severe hydronephrosis and the questions to ask at your first pediatric urology appointment. If your child's kidney issue was discovered during pregnancy, that video is your essential next step. Your child is lucky to have a parent who searches for answers. Never forget that.